Joining us on Culture Architects today is Dr. Roger Gerard. Roger is the owner of Sloan and Gerard Consulting. He's also the author of Lead with Purpose, Reignite Passion and Engagement for Professionals in Crisis. Roger brings with him to the show 5 decades of experience as a healthcare executive and leadership consultant. Dr. Roger was vice president for human resources at Northern Michigan Hospitals, and later he was the chief learning officer at the Wisconsin-based healthcare system called ThedaCare. His wealth of experience, of course, goes well beyond just the healthcare industry. So we're excited to chat with him today about all things leadership and, of course, all things culture. So, Roger, welcome to the Culture Architects podcast.
David, thank you for having me here. This will be a fun conversation.
Absolutely. So let's get started with a little bit of your background. So I saw I know from your educational background, you have a background in humanities and philosophy. I was a philosophy major in school as well. So we're both philosophers at heart. So how did you go from that background in humanities to get into most of your career into the healthcare industry? What was the origin that led you into healthcare?
Well, my very first career position after I got my bachelor's degree was with the American Cancer Society in Michigan. Okay. And in that role, I became acquainted with the healthcare industry from a little bit of a distance. But I got myself deeply involved in the training and development of people doing cardiopulmonary resuscitation. That's how I learned how to do mass training and how I got acquainted with people in the healthcare industry who were doing marvelous, marvelous work. I was dealing with rescue people. I was dealing with nursing and physician folks in hospital settings. I was engaged in an industry right out of college that impressed me significantly. Even prior to that, while I was in my undergrad work, I spent 2 years mopping floors and doing housekeeping work in a hospital in the Detroit area. So I had that inside exposure that led me into that kind of a career. From there, I directed a 3-hospital training consortium in Michigan, in the Detroit area. For 2 years, and then I moved from there into a role with the American Cancer Society and spent almost 4 years as the director of field services for the Detroit metro area of the American Cancer Society, where we did all of our service programming, fundraising, some of the education programming in the community. And I learned the ropes of leading people and creating boards and creating committees in the community, volunteers who wanted to do some good work. Out of that, I jumped into manufacturing. I spent 3 years in the manufacturing industry with Gulf Western Manufacturing doing leadership development, which was great fun.
As I think about the healthcare industry, if we just start there, you commented, Roger, that you've seen so many dedicated, committed people in healthcare that really have a passion for wanting to make a difference for people. And yet I'm imagining that in the various experiences that you had, having seen so many different professionals, I would bet that while you've got a whole bunch of people who really care passionately about doing great work, they were working in different environments. And I imagine you saw some of those environments that cultivated people being able to do their best and other environments that made it hard for people to do their best. Talk to me a little bit about what you've observed in the differences between those and how it impacted people who all genuinely wanted to care and to do great work.
Absolutely. I love the way you frame the question. People who go into healthcare or teaching or some of the other service kinds of industries, they all come into that with a bit of a mission. When you interview them, when you talk with them at any depth, what they tell you is they want to help people. They come to the party with an internal drive to do something that adds value to somebody else's life. That is a special kind of person. Those folks are doing this as more of a calling, a vocation, than for great wealth or great renown.
Mm-hmm.
They're not there for that. They're there to make a difference in somebody's lives. And I learned that when I was a housekeeper in a hospital. I learned that again when I was with the Heart Association and the Cancer Society. As I met all of these wonderful people, I was struck by how they worked from a point of view of a mission.
Mm-hmm.
After my 3 years in manufacturing, I was invited by one of my previous bosses to come up to Northern Michigan and be part of a hospital organization up there as their director of organizational development. I did that and became the director of human resources as part of that journey over 8 years and part of the senior executive staff. And I was still very much struck by how much people cared about the work that they were doing. That transferred to my work in Appleton, Wisconsin at ThedaCare. Again, another healthcare system where I was a senior executive working with all kinds of professions. And again, they cared. They
Mm-hmm.
cared deeply. And to me, that has been a blessing in my career that I've had the opportunity to see this in so many different locations and so many different ways of doing healthcare work. The difference is more attributed to the people doing the work than it is to the way these people were managed. In
Talk
many of
more about
those
that.
cases, the professionals had a little bit of a love-hate relationship with the folks in suits.
Mm-hmm.
And I was one of those suits.
Mm-hmm.
But having said that, they were able to kind of overcome that little bite and really stay with their calling and stay with their profession and do the work they loved. What concerned me in the last 10 years is that I've seen a shift in that. I've
Mm-hmm.
seen a big shift in that, primarily in the healthcare industry, but I've seen it in other industries as well. About 5 years ago, I wrote a book called Owning the Room. That book was kind of a post quote unquote retirement, which I don't use that word anymore. I now use the word repurposing.
Mm-hmm.
But after I left ThedaCare and started doing independent consulting, what happened is I was researching Owning the Room and I started feeling a level of alienation that I hadn't seen. Owning the Room was about leadership. It's about taking responsibility as a leader and owning the job of building the culture, building the framework for highly effective, outstanding performers in healthcare.
Mm-hmm.
What I learned is that people weren't feeling well treated.
Mm-hmm.
People were not feeling like they could take the time they needed for themselves and for their families and for the other people around them and for the other dimensions in their lives. And as healthcare has become more measurement focused and business focused, the alienation has increased.
So you see a change in that.
And now it's all about
area.
leadership.
Mm-hmm.
Now it's all about how effective are leaders in instilling in that relationship with the people doing the daily work a sense of value and a sense of belongingness.
Mm-hmm.
It's about community. It's about bringing people together to do great work in an environment where they feel like they are valued.
So,
and that alienation is harming the healthcare industry. It's harming patient care, and it's harming the professionals.
Yeah. So I want to go back a little more historically in the observations that you've had and then bring that up to the current. So in the past, you've worked in these various places. And as you said, as I hear you saying, you've seen, it sounds like pretty consistent level of passion, commitment, dedication to purpose among workers in healthcare. And yet, again, I'm guessing that while if I'm one of those healthcare providers, whether I'm a physician, a nurse, a assistant, a technician, whatever, I may have tremendous passion, and yet my experience, at least, is if I work in a place that supports me, that engages me, that rewards me emotionally and otherwise, it enables me to do the best work that I could possibly do. And conversely, if I'm in an environment where I'm constantly fighting against the environment, it makes it a struggle for me to live out the passion that I have. And so I'm imagining that you've seen lots of different kinds of environments. And even within a hospital system, I'm sure there are different offices, different departments where some of them really nurture the ability of providers to do their best and some don't. So talk to me a little bit about what you've observed in the areas where they do it well, what happens, and the areas where they don't do it well historically. What's the difference?
The difference is there are several elements in trying to define what's different.
Okay.
For instance, you're very right. Different context creates different dynamics.
Mm-hmm.
For instance, if I'm working in with a group of people in the ER, the
Mm-hmm.
emergency area of the organization, the psychology in that environment is very different than, say, out on med surge or in an office setting in the hospital institution, where things are a little bit calmer and easygoing and not so much emergent psychology going on. You have different kinds of people in different kinds of environments, and you have to pay attention to those differences as you're trying to craft community, as you're trying to create a cultural set of values
Mm-hmm.
that help drive what's going on. You can rise to a high level and say, okay, the organization needs a core mission that everyone understands, a vision for the future that everyone understands, and a single set of core values that we're all going to adhere to in order to be, in order to understand how we're going to relate to one another.
Mm-hmm.
We also need to understand what the organization is doing strategically so that we can all be aligned with that as professionals. Those are the givens in
Right.
every large organization. But when you start winnowing down into the different parts of the organization, you find you have different tribes. You
Mm-hmm.
have different ways of thinking and different ways of doing things. And one size fits all does not work. You cannot do it that way.
Sure. So, but let's go back to,
Yeah.
I hear you saying that an emergency room is going to be different than a doctor's office, than different a med surge office, et cetera. And yet I'm imagining, and you can tell me if you see otherwise, but if you saw 15 different emergency rooms, so let's control for it's all emergency rooms. If you saw 15 different emergency rooms, I'd be willing to bet there's 15 different cultures, and some of them end up being a hell of a lot more effective, and some are less effective in
Yes.
enabling people to do their best work. So I'm wanting to get clearer on, so among the ones in whatever the department is, if I'm comparing just emergency rooms versus, or I was looking at 15 different med surge operations, what do the best ones do? And when I'm going to say best, I'm talking about ones that enable their staff to live their purpose most successfully. What do the best ones do that the others don't? What's the difference between them?
I love that. Let me start with the beginning. Um, the best ones
Mm-hmm.
have leadership that understand what people need from them as leaders.
Okay.
And very often, people move into leadership without having the requisite training to become highly effective leaders.
Mm-hmm.
Most people move into leadership from in an industry like healthcare, move into leadership with a very defined set of knowledge and skills that is more technical and science-based than
Mm-hmm.
human-based.
Okay.
And so they haven't received the necessary training to understand what people need and want from their work and from their role in the organization. I think it's incredibly important for leaders to spend a concerted amount of time, not just generally, but individually, to find out what people in their charge want and need from their profession.
Mm-hmm.
And leaders don't take the time to do that. I can't tell you how many times I've interviewed staff in focus groups or individually and asked them how they get along with their leader. And people have looked at me with wide open deer eyes saying, I
Mm-hmm.
don't even know who my boss is.
Wow.
I haven't seen my boss in more than 6 months. They're so busy in meetings and so busy in doing the administrative tasks that they think they're supposed to do because of their science-based background.
Mm.
And they're not taking the time to craft the relationships that cause people to feel seen, heard, and acknowledged. That's so critical
Mm.
in everyday leadership, and it's missed by people in leadership. The
And would you?
profound difference you're looking
Mhm.
for is a leadership difference.
Got it. And would you say, I know most of your career has been in healthcare, but you mentioned you spent a few years in manufacturing. Was there anything different about that in manufacturing, or it doesn't really matter what the industry is from your perspective? It's still
Some of
leadership.
both. People are people, and so the processes are pretty conformed and pretty common. In manufacturing, you have a product. In manufacturing, you have a um, very clear process for producing that product and for introducing that product to your customers. Much of manufacturing, unfortunately or fortunately, depending on your point of view, and we can talk about that, much of manufacturing is very systemized. And so people's roles are clear, their task distribution is
Hmm.
clear, their relationships are clear. We all know who's in charge. And so there's a lot more clarity about how people work than what you find in most what I'll call professional environments,
Mm-hmm.
uh, where people have a lot more professional autonomy to do their work according to their own professional training. So there are some differences that you have
Mm-hmm.
to address and recognize as you do this work. But in healthcare, you have to understand that you're dealing with people who are practicing their professions.
Mm-hmm.
And autonomy for most of these professions is a very, very important feature of their profession. They have to be able to exercise judgment in situations where there aren't clear answers.
Mm-hmm.
Um, that makes a big difference.
Got it.
Leaders have to understand that and recognize that as they work with their staff.
But ultimately, what I'm hearing you say is that in your experience, and matches my own, excuse me, that in your experience, the biggest the biggest factor, and correct me if I'm saying this incorrectly, but in your view, the biggest factor that drives the creation of the kind of culture that helps people to be successful is that it starts with leadership. That's
It it
the
it, it all begins with leadership. Just a kind of an anecdote about
mm-hmm,
that. I was called in by a senior VP in one organization to join one of their staff meetings. And I walked into the conference room, and there were 30 supervisors and managers. And this executive was in the front of the room attempting to lead a conversation about the concerns and issues that were affecting the management team of the organization.
mm-hmm.
She asked them a basic question. Does anyone have any concerns they want to put in front of the group? Not a hand went up.
It must have been a perfect group.
Total dead silence. And she was about to say, okay, the meeting will be adjourned. And I cut her off. And I said, would you like a little help with this? And she said, sure, come on up. And so I went up to the front of the room and I broke them into 4 groups of about 8 or 9 people each. And I asked them to brainstorm what are the biggest Excedrin headaches they contend with every day? What is their best advice to their executive leadership? And if they could have the world just the way they wanted, what would be the most important change they would make in how
Mm-hmm.
things are being done? The room exploded.
Yeah.
They were hungry to have their voices heard, but they couldn't do it in that group of 30
Mm-hmm.
people with the executive in front of the room taking names and taking notes.
Mm-hmm.
That wasn't going to happen. But this is an example of a leader responsible with great responsibility who didn't have a clue
Mm-hmm.
how to engage with the very important professionals working with her.
Yeah. And what's interesting about that anecdote is I would guess, obviously I don't know the person, but I would guess that leader at her core, she cared. She wanted
Yes,
to address their issues. She just, to your point, had no clue, no skill set for how do I effectively bring that information forth, and therefore do something
that's
with it.
exactly right. She was a scientist, and
Mm-hmm.
she got to her role because she was a really good nurse.
Mm-hmm.
But nobody had given her the time or the training to say, now you're in a different world. Leadership is
Yeah.
not the same as nursing.
Yeah. So if I kind of summarize what I hear you saying is that across almost all organizations, at the end of the day, in order for people to be able to perform at their best, they need to be in the right kind of environment, and leadership has a significant role in shaping that environment, or it's really their culture. And that further, if we look at most leaders, if not certainly a large majority of leaders, might be well intentioned, but don't have the training or the skill set to effectively deal with the human side of their people. Maybe they can deal with the scientific side or whatever the product or service
Yeah.
happens to be, but the human part of understanding people and being able to relate with people and connect with them is missing for many leaders. And that's the part that's the biggest gap that you say. Is that an accurate?
Yeah, I did an interesting experiment with that, and what I can do is I can tell you what that gave me. I asked a basic question. I
Mm-hmm.
asked, what do you as a professional really need from your leaders? And I
Okay.
did probably 20 focus groups on this to kind of distill it down and see what I could learn across different professional groups.
And
And this is what they told me.
before you tell us the answer, I have a question for you.
Yeah.
Did you have a hypothesis about what it would be, and did the result differ from what you were guessing it might be?
My hypothesis would be they need to pay us more. They need to give us better benefits. We need more time at home. We need we need less overtime.
Mm-hmm.
My hypothesis was that it would go to all of the hygiene factors,
Okay.
all of the daily gripes
Attributes at work. Mm-hmm.
that we would listen to, and that they would want things to fix. They would want solutions to those problems.
Mm-hmm.
This is what they told me instead.
Okay.
Professionals expect to be able to do the right thing. And the right thing is formed in their training and their professional disciplines, and they expect their leaders to back them when they do that. That's a whole different paradigm.
Mm-hmm.
That's not about the hygiene needs. That's about respect the profession that I bring to the daily work of this organization. The second thing they wanted, I want an environment of safety. I want to know that I can make hard decisions and do the things I'm trained to do and not be disciplined for it later.
Mm-hmm.
They want to be able to use their autonomy. Listen to what they're telling me here. This is all about practicing their professions. It's not about the hygiene factors. They expect to be able to focus on what matters most, both to the organization and within their professional standards. They expect to be involved in the decisions that affect them instead of being told what to do, when to do it, where to do it, now.
Mm-hmm.
They expect to be compensated professionally. What happens to a lot of these folks is their professions lag after they've been in the job for 3 or 4 years, and they don't get the increases they think they should be getting.
Mm-hmm.
Professionals want to know that they're valued, and compensation is a form of valuing. They expect to be able to meet their own needs while doing everything else. And if they're being required to have mandatory overtime and their weekends are shot and all of this starts to go away, yes, they have a calling, but they also have a family and they have other parts of their lives that they want to pay attention to. this is what I was told.
Yeah. Interestingly, in my first company that I had run, it was an employee benefits consulting company, and I used to do a monthly lunch where my assistant would set up a lunch for me to meet with a handful of team members. And she would pick them at random and we'd go out to lunch. And I called it my best places to work lunch, in that my goal for those meetings was I didn't have any specific agenda, but just to get to know people, let them get to know me, and to ask questions about what makes any place, similar to your focus groups, what makes any place a great place to work? Not necessarily our company, but like what do you value? And the way that I summarize what I heard from people is it matches much of what you're describing in its simplest form. They wanted to be treated like adults. And, that's so sad in a way that, that they would see that as something that they didn't have in many places. Thankfully, in my company, they did. But in many places they had worked elsewhere, they weren't treated like adults. And so to your point, those are what does it mean to be treated like an adult? It means, yes, I'm trusted to make good judgments. I'm backed when I do. I have the freedom to make good decisions about things. I'm a part of the decision making about my work. It's all those things. I'm trusted enough that if I need to take time off, I don't need to document it in 17 different ways because I'm an adult. You can trust me. And that's what people valued more than anything else. And it was striking that it didn't exist in so many other environments.
That's exactly the point. I use the word respect a lot in the first book, Owning the Room, and I amplified it further in Lead with Purpose. This is about respect, human being to human being. A lot of American industry is still Taylor-esque. It's still top-down. It's still a bit autocratic. And this interferes with the idea that we are all professionals working together, practicing our professions as equals, as people who care about one another. I spent some of my time in the 70s as a community organizer. I understand how to bring communities together, and hierarchy doesn't work really well. And institutional life is a hierarchical structure. We talk a lot about relationships, but the structural context makes a difference in culture as well. How you organize people.
So when you make the observation, as you have over your extended career, that it's largely about respect, that leaders need to demonstrate respect for the teams that they're leading. I'm curious about just your point of view. Why do you think that doesn't exist? I mean, even outside of the institutional structure, if I'm a leader, it doesn't matter what the structure is, I'm still a human being. Do you think that many leaders, and obviously not everybody's the same, so we're talking about generalities here, but do you think that many leaders simply don't respect, or they are unaware of how the way in which they're behaving may be coming across as lack of respect?
Beautiful. They don't know that they don't respect.
Mm-hmm.
And let me tell you a funny little story about I sent a group of executives as part of a week-long retreat. I sent them back to their workplace for a 2-hour experiment.
Okay.
So 20 guys, 20 execs went out to their workplace, and their charge, their assignment was to go and see.
Mm-hmm.
All that I asked them to do was go and spend an hour, watch what's going on, and be prepared to come back and tell me what you saw.
Okay.
Dutifully, they all went out. They spent their time in their units. They came back, and it was amazing to hear their reports. Their reports were, I saw this problem and I fixed it. I saw this person struggling and I helped them get over the struggle. I saw this resource need, and so I made sure they had the resources they were supposed to have. It was one story after another of executives going in and fixing problems. Mm-hmm. And I told them that they all failed the assignment. Their job was to go and see and report back what they saw, not to
Mm-hmm.
fix problems. In fact, every one of the problems could have been fixed by the staff themselves.
Mm-hmm.
And instead of helping them do that, they fixed it for them.
Mm-hmm.
That's enabling dependency. That's not leadership. But this is what leaders often think their job is to go fix things. No. Their job is to empower and enable the professionals in their charge to work their own day, to do their own work, to do their own problem solving, and to take pride in that and take responsibility for their daily work. That's what a leadership does.
Mm-hmm. So it sounds like, in your experience, certainly this group and many others, we're seeing leadership as my job as a leader is to fix problems versus my job as a leader is to empower my people and develop my people to become more effective people themselves.
Perfectly stated. Perfectly stated.
And so as you think about that, so is that mostly, in your view and experience, then simply a training issue, that we need to provide leaders with better training to understand, number one, what their role really is, and then number two, how to do that role more effectively?
Training is part of it, but it's not the whole picture. Okay. I would start with selection. Okay. You got to make sure that if you're putting people in a leadership position, they're prepared for a shift in how they see themselves and how they conduct their daily work. If you take a scientist and put them in a leadership role without any proper orientation or training, without any other influence, they're going to take a scientific method approach to their leadership because that's what they know.
Sure.
If you spend some time finding people in that field who also have a natural orientation to human relationships, well, then you might have a better leader. They may not be your greatest scientist, but they might be a greater leader than the pure scientist who comes into the role. I have had the privilege of working with a couple of research foundations in my work, and people in the research industry are wonderfully, wonderfully trained to be excellent scientists. They really understand the scientific method, the research methodologies, and everything that goes into that. I can tell you for a fact that if these foundations needed new leadership, they needed to bring the leadership in from the outside because there weren't the raw materials for leadership within the scientific ranks. Now, that's a pretty controversial thing to say, but leaders have a different set of skills. They have a different set of perspectives on how things work. And you need to respect that and honor that. One of the things that concerns me today is that leaders in many industries are not being respected, and leadership is a practice that needs to be respected.
And what does that mean? What would it look like for leadership to be respected? What does that actually mean?
Well, I'll tell you what it looks like when it's not. Let's say a physician moves into a leadership role and becomes a chief medical officer. Suddenly, the docs in the organization no longer perceive this person as a colleague. They now perceive him as a suit. And it's us guys versus them guys from that point forward. That's a disrespectful approach to the relationship.
So I hear what you're saying there, and I want to push back a little bit on just trying to understand. It's one thing to say, well, leaders need to be respected. How does that happen? I mean, you can't just go to the staff, say, all right, guys, you got to start respecting these leaders more. So it's one thing to say they need to be respected, but how do you create that? How do we do something about that?
Yeah, my mother used to say, if you have to ask for respect, you probably don't deserve it.
That's probably true. It may be true. But how do you create that? I mean, what I really, and I'm pushing hard a little bit here because for our audience sake, I want to make sure people can walk away and say, all right, there's something I've learned here that I can do something with. So I'm listening to this and I hear you, Roger, saying that leaders are a different breed than others and that we got to select the right kind of people. We got to give them the right training and they need to be respected.
Yeah.
What do I do to make sure they're being respected?
All right. I advocate that leaders make 5 promises and then keep those promises as if their life depended on it.
Let's go.
I'll give you all 5.
Great.
Promise number 1, I will listen to you and take what you tell me seriously.
Sounds like a good one.
I may disagree with you in that process, but you'll
feel
know why
heard.
I disagree with you. But I am going to listen and I'm going to take what you have to tell me seriously. That's promise number 1.
Okay.
Don't discount what people come to you with. Promise number 2, I will help you learn and grow as you practice your professional work.
Okay.
I'm going to provide you with whatever you need to keep your training up to date, to keep your knowledge up to date, to keep your experience up to date, but I'm going to help you grow and learn in your profession.
Okay.
Promise number 3, I will help you be wildly successful. I want you as my professional staff to be successful. And if there are obstacles in the way of that, if there are things that are preventing your success, you need to tell me, and we need to work together to remove those so you can be successful in your profession.
Okay.
Promise number 4, I will make sure that you're compensated competitively. Now, what that means is probably 60 to 65% comp ratio, because data lags. You never, anytime you get a data report on compensation for professionals, it's about 6 months old, maybe a year old, and you have to get ahead of the 50 percentile comp ratio. So if I'm going to promise you that you're going to be paid competitively, you're going to be making at least, if not more, than what our competition pays.
Okay.
Promise number 5, I will have your back when things go wrong. Not if, when they go wrong. You're not going to be disciplined when things go wrong. You're going to be helped. You're going to be trained. You're going to be helped to go through that and take responsibility for it and get things right. These 5 promises are golden promises. And if you make them and keep them successfully over time, people are going to respect that. They're going to respect that as a leader, you had their back, you helped them be successful. They are having all of the knowledge and skills and training that they need to be successful in their practice. And trust builds. Trust builds as the promises are kept. Once you have established that trust relationship, and it can take many more than months, sometimes years, but once you establish those relationships, people aren't going to want to leave.
Yeah.
They're going to want to stay because, in the Gallup research that's been done on engagement, what they tell you is that the single most important factor in professional engagement is the relationship they have with their one-up.
Yep. I've seen that many places.
That happens because of promises made and promises kept.
Yeah. And so clearly then, if I'm a leader, to the extent that I'm making those kind of promises and more importantly, keeping those promises so that I have that kind of a trust-built relationship with my team, we're going to have a better team. We're going to have a better relationship. They're going to be more engaged. They're going to be more successful. So it's critical then that leaders learn how to do that.
Yes.
You were talking before about one part of that is training. One part of that is selection. We've got to select people who are at least have a higher predisposition to being able to be taught to do those things.
Correct.
Some people are more likely to be able to do that than others. What are some things that listeners can do if they're in leadership roles to be better at finding people? So I'm interviewing somebody to be in a leadership role. Maybe I need to bring them in from the outside because, to your point, depending upon how they got into roles, they may have a strong scientific bias that may not be as humanistic a bias, depending upon where they're coming from. So there's some aspect of that. But now I'm interviewing some potential people. What are some of the things I'm looking for in interviewing to help identify who might have a higher probability, and recognizing we're all just trying to stack the odds in our favor. There's no guarantees here, but we're trying to stack the odds in our favor that the person I'm interviewing, the man or woman, has a higher predisposition to being able to learn these kinds of skills if they don't have them now. What are some things I'm looking for when I'm interviewing? How do I figure that out?
I love that. There are two factors to selection. You select people in, but you also select people out.
Okay.
I want to talk with the select people in first, because that's the question that you asked. I'll tell you a story about an engagement I had way back in the early 80s. I was a creative executive in a consulting firm in the Detroit area, responsible for some significant work with a couple of international organizations. I can't name them, but what I can tell you is that the project was all about leadership development, and we were creating an international leadership system for that company. I was looking for a couple of management types to manage a couple of projects. And I had two candidates that I was looking at, one with stellar credentials, great references. This guy walked into my office and we had just a marvelous conversation. And at the end of the conversation, I asked him if he would mind taking a portfolio that I had prepared and give it a once over and give me a recommendation on how that situation in that portfolio would be addressed. And it had multiple documents and all kinds of things in it. And he asked if he could take it home and come back to me in 2 days with an analysis and a report. And I said, fine. And he left. And then the next candidate came in, and she went through the same process. She didn't have quite the experience that the first guy had. She had glowing references. She really had energy. And as we were having our conversation, I did the same thing. I gave her exactly the same portfolio and asked her if she would mind taking a look at it. She opened it immediately. And as she opened it, she started scanning the documents and began asking me questions. She wanted to know about the client. She wanted to know about the problems that the client was facing. She wanted to know about the staff who were applied to the project. She wanted to know 100 things. And as we talked, her recommendations started to emerge from the conversation. Which person do you think I hired for that job?
Obviously the second.
Of course. And the reason is she was immediately engaged. Too often our interviews are structured around the resume and around the job description, and they're not structured around the person that you're talking with. And what we have to do is we have to learn how to sort out who the individual is that we are confronting with this job. And we have to determine what kind of human being we're going to have a relationship with over the next, I don't know how many years. And that requires dialogue. That requires conversation. That requires getting to know one another. And I think that's probably the most important thing I can tell you about selecting people in. Take the time to get to know who they are, really. I've done the same thing with physicians. I've done the same thing with nursing staff. And the more you can give them a challenge and then ask them to deal with the challenge, the more you're going to learn about who they are and what they're made of. Now, let's talk about selecting out for a minute. In every organization, I've learned that you're going to have people who I would define as cynics, apathetics, naysayers, people who are kind of checked out on where the organization's going and what they're about. With these folks, you've got to give them a chance to understand what is really required, and you've got to take the time with them to say, look, I see these behaviors. I see this in you. Is there something going on that I can help you with? Because I want to see a change. And this is specifically what I need you to change. You have to have that conversation. If they don't change, if they don't start to align their behavior and their work to the needs of the organization, you're probably going to have another conversation that goes something like, I need you to be successful somewhere else.
Yeah.
I need you because what you're doing is not in alignment with what we're trying to accomplish. So how do I help you find your next career position somewhere else? You're not happy here, and I don't think I want an unhappy employee on my staff.
Yeah.
Those two conversations are very, very important conversations to teach leaders how to have. You
Yeah.
select people in, you also select people out.
Yeah. I have sometimes, in an overly simplified way, said to people, in my experience, as you start to get serious about working on your culture, typically, if you evaluate the current staff in terms of their degree of fit in the culture we're trying to build, they usually will fall into three groups, probably not that dissimilar to what you've identified. One group are typically people, and it's usually the largest percentage in a good company. There might be 70 or 75% of people who are a really good fit, and they're great people. And, if I was hiring again, I'd hire them.
Yep.
And then there's usually a middle group, in my experience, of about 20% or so, who are in a category that I say, they're not bad. If I was hiring today, I don't know that they'd make the cut, but it's not like they're ruining the company. And those people, I always advise, we should be coaching, mentoring, trying to do everything we can to help them be successful. But to your point, most of them aren't going to make it. But I want to give them every chance. We want them to be successful. And then I find there's typically 0 to 5% who are those people who are the cynics, the ones with the lousy attitudes that are working against us. And those people, in my view, I want to clear those people out as fast as we can, because they're undermining everything we're trying to do to be successful. But most of them, the middle group, are the ones that we want to be coaching and helping, but most of them aren't going to make it at the end of the day.
Absolutely correct. I love how you've created the spread. And in poor cultures, the percentages might be different.
Right.
You might have a lot more cynicism and apathy than what you've just described. I did a show of hands with a group of about 150 managerial leaders in one organization. It was a fun day with them. And about the middle of the day, I asked for a show of hands. How many of you have what you would consider marginal employees on your staff? Literally, every hand in the room went up.
Mm-hmm.
I then said, how many of you have had a conversation with those marginal staff within the last 30 days? 10 hands went up.
Yeah.
Well, who's marginal here? Is it the staff or is it the management?
Yeah.
We have to be pretty we have to do our jobs as leaders if we want the culture to become what the culture needs to be.
Well, my experience of that, and I would agree with you 100%, is that so often we are annoyed at how people are, but we've never been very clear about setting expectations about what it is that we're looking for. We're just annoyed they're not being how we want them to be.
Yeah, but what I find in some industries, particularly in healthcare, when you start having this conversation about, that's not working, that person's that cynicism is not helping us. Well, but she's a great nurse,
right? Oh, of course.
This doctor, we depend on his revenue. We have to have this doctor. And it's like, wait a minute, you're sabotaging your own success.
Absolutely, yes. We're telling people our culture is really important unless you're hard to replace.
There you go.
Then it's not so important. The phrase that I have often said is that the best way for me to know any company's culture is to look at the behavior that they tolerate. What they allow to continue to take place, that's the real culture. Everything else is just a bunch of fluff.
The other side of that, too, is there is a human side of this. I've had conversations with people who are in that cynics, apathetics, and naysayer role. And when I really dig deeply into why they're feeling the way they're feeling, they sometimes break down in tears. They are very unhappy people.
Oh, yeah. Yeah.
And because of that unhappiness, they're acting out. And if you can find a way to bridge that unhappiness in some way, you might be able to help them become more aligned. you might be able to help them become happy by leaving the organization. I was
Yeah.
sitting with a physician one day. I had done some assessment work with him and his colleagues in a practice they had. And this physician, in my one-on-one with him, broke down in tears as he was looking at the data he got from his raters.
Wow.
It was
Mm.
his raters really did him a favor by telling him the truth about his
Yeah.
behavior. And I asked him why he was in tears. And he said, I hate my job.
Wow.
And we were silent for a minute. And he said, well, what do you say about that? And I said, my reaction is, I never want you to touch my body as a physician.
Yeah. Yeah.
If you're not happy in your work, you need to do something else. What would you love to do? He said, you know what I love? I love being out in the woods. I like
Mm-hmm.
working with animals. I like being
Mm-hmm.
somebody who's tromping around in his boots and driving around in his Jeep. I said, why don't you do that? 9 months later, he was a forest ranger,
Hmm.
no longer practicing medicine.
Well, it was
Happier,
good for
happier
everybody.
is, yeah, and that's exactly where he belongs.
Yes.
He,
Yeah.
he was
He did a
happy as
favor
a
to his
plant.
patients.
So,
Yeah, interesting. Well, Roger, this has been a fascinating conversation. I have two last questions for you. So,
sure.
one, I'm always curious about anybody in any role, and certainly somebody that's had the vast amount of experience. I'm not making a comment about your age here, just that you're lots of experience. I'm always curious about, I find that there are things that we learn over time that we look back in our career and think, how did I not see that before? Like in retrospect, with perspective, there's wisdom, hopefully, that we gain that we didn't have when we were younger. What's one piece of sort of wisdom that, if you were coaching your 22-year-old self, the 22-year-old Roger, and sharing some of the wisdom you've learned over your years, what would you be saying to that 22-year-old Roger that maybe you didn't realize back then?
Wow, great question. Thinking back when I was 22,
Mm-hmm.
freshly married, first baby on the way,
Mm-hmm.
bachelor's degree in hand, and I was in charge of the world. I, 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 I think if I were to do some of the instrumented profiles that I've been exposed to over my
Mm-hmm.
lifetime, if I were to do some of those at the age of 22, I probably would have come across as one of the most arrogant sons of beasts that you
You
could.
knew everything.
uh, but you know what? I would tell that arrogant person to humble up,
Mm-hmm.
listen, and learn. You got a
Mm-hmm.
whole lot of life in front of you and a whole lot of learning to do, and it's going to be a great ride. So don't
Chill
get
out.
too cocky. Don't
Yes.
get too cocky. That
It
that
is.
would,
Uh-huh.
as you asked me that question, that's where it would go.
And,
I tend to think that all of my different areas of education, my master's degree, my
mm,
doctorate, they all humbled me
mm,
from one step to another.
mm-hmm.
What a doctor tells you is what you don't know.
Yeah.
And it's like, okay, that's life. I
Yeah.
keep learning, and I'm still learning.
That's great. My last question for you. So, if our audience members want to learn more about your last book or your consulting work, um, where would they go? Tell me how people would find out more about you.
I tell every leader that the first thing they have to do, and the most important learning for them, is to go and see, and then go and do something about
Mm-hmm.
what you see. Go and
Mm-hmm.
see, go and do. To find me or to find
Mm-hmm.
my books, go to
Mm-hmm.
my website, rogergerard.com, and you'll find links to my books on Amazon. You'll find all kinds of links to my blogs on LinkedIn. I'm on LinkedIn. You'll find other podcasts that I've done. It's all there on my website,
Great.
rogergerard.com.
And we'll put that in the show notes. But Gerard is Gerard for those
Correct.
that are listening to this and not looking at something. But we'll put those in the show notes too. Well, Roger, I really appreciate you being with us. It's been a fascinating conversation. Thank you for contributing to the education of our own audience in learning how to be better leaders, how to build better cultures, how to help people to perform at their best and create environments that enable them to perform at their best. Really appreciate you being with us this morning.
David, thank you very much for having me. I enjoyed the conversation as well. It was fun.
Great.